Viewer discretion advised. I'm going to be sharing a video on a wound care case that we had several years ago where we're cleaning up his hand wounds. Now, if you're an occupational therapist and you're interested in hand therapy, wound care is a really big aspect of hand therapy. It doesn't have to be the end all be all if it's not your thing, but I just wanted to advise you on that it's going to be a wound care video. My name is Huang Tran. I'm an occupational therapist and certified hand therapist, and I help other OTs and PTs work in and develop their skills in hand therapy. Again, sometimes people tell me like, oh, they're like too scared of wound care. All wound care isn't the same. Sometimes you can have it where it's not really bloody, and then sometimes you have it where it can be really bloody. But here's an example video of a guy that we had. He had a 4th of July accident, so it's right in time for that. But he had an accident with some fireworks, and he came in, both his hands messed up, both of his hands like literally just wrapped down because he didn't know what to do. And here is a video just showcasing a little bit of what we did on one hand. Enjoy the video.
Right, Jocelyn?
So let's take a look at this wound. Can we zoom in here? And
We're just taking out some of the stitches.
yeah, so we're taking out some of the stitches. We're taking out the crusty black skin. If you take a look at the wound, take a look at the hand. The hand is really dry and ashy. So the key thing is to remove the stitches, remove the debris, which is all that scabbing. You can't see underneath a wound, means you don't know if it's fully healed or not. So sometimes you have to remove some of that. So what she's doing, she's just removing some of the dead skin and clearing up that space. Anything where there's a lot, like,
I'm sorry? Is this all for today? Yeah.
if it's too dry, you can use a little normal saline, or you can put a little bit of cream on it to loosen it up, versus just pulling and it's painful. Right. And then once that is cleaned up, no, it's just water.
It's just like water without, it doesn't sting or anything. Yeah.
It's normal
One thing I
saline.
wanted you to look at is this little area right here. There you go. See how easy that came out?
All right. So normally one of the things that I do is, I'm sorry, I'm not following my own rules. Let me get my mask on now that we're closer together. So one of the things that I'm going to do is I want to make sure that my 4x4s are out, so I don't go and put my hand into it once my hands already, like once I put the gloves on, my hands are clean, I can go and grab it. Once I'm already doing some work, then my hands are not clean, and in order to not have to deglove and reach in, I'm going to take it and put it out extra. One of the things I like to do is I'll take a 4x4, I'll scrunch it up, and then I'll pour it into my hand. That way it's going to stay, and then I could pour it over their hand or wash it. Looks good. Let me take a look at your hand here.
Look under it.
All right.
This came out of it.
All right.
Some came out of it. I think it's probably out of this issue.
This one?
Yeah.
All right. So the scab, what happens with the scab is it's so thick. Sorry, I have to press on it and see. Does that hurt? So the scab was so thick and deep that it created like a cater in it. Imagine it's like it just bridged it. But what I'm gonna do, I have to open up your thumb a little bit because I gotta clean in between the crease. All right. And put a little extra water. And let's make sure we clean. Does it hurt a lot? Yes. Tell me when you need a break, okay? Alright, this is just dead skin. Alright, I'm just double checking that there's nothing else that I need to worry about. Alright, so you see how deep this is? It hurts a lot, right?
Yeah.
Okay. What I want to make sure that's not happening is there's no tunneling of that tissue. So all I'm doing now is I just want to clear up the space. Anything that's around the crease here, if you have too much debris, what happens if you have too much debris is that junk can get stuck underneath it. See? So I want to make sure that there's not any junk that can get stuck underneath it. All right? All this will come off with time. We just got to clean it off. All right, so when we wrap it, we're gonna wrap it and make sure that we leave some space here, because you're all, see anything that's white under here is not, it's not good, because we wanted to oops, sorry, we want to make sure that it is dry enough to be able to heal. Wounds that are too wet won't heal, and wounds that are too dry won't heal. You see how this is all like around the borders? We just need to remove it so it doesn't get, stuff doesn't get caught underneath it. There you go. All right. Need a Q-tip. So when I see something deep, I just gotta go and make sure there's not tunneling. Oops. Inside. So I'm just gonna take the Q-tip and I'm just gonna go and make sure I can clean inside that. I know, I'm sorry. So I'm gonna stick it and push it in different directions to make sure it doesn't go anywhere. And then I can measure how deep it is. So it's about 1/2 centimeter deep. So when we go to dress it, we have to pack it a little bit, okay? That's the worst part, right? Take a look, can I feel your hand? Can't remember, this one, put your hand up like this. Perfect. What?
What you looking for?
Oh, I'm just looking at how your hands feel. That gives me an idea of like what's going on and what I can tell you what to do, and like you were asking me questions about this finger, like why doesn't it open and stuff like that. All right. Can you open your thumb? Excellent, good. All right, and then come down, relax, and open up your thumb. And relax. All right, and then down. Okay. So, relax. Okay. All right. So let's go ahead and let's finish cleaning this up. I would say go ahead and clean it up and then wrap it up, and then we'll move on to the next.
Okay, so normally we do water and soap. So just use natural sealing water.
Yeah,
and
just
soap? Okay.
just wash it a little bit, and then we'll move to the next.
I hope you enjoyed the video, and I hope it shared and shed some light on what wound care can actually be about in hand therapy. Wound care is so necessary because in order to advance your patients, you have to be able to help them close their wound up, clean up their wound, so you can do a lot of scar management and you can be more progressive in the amount of therapy and range of motion and function that you help your patients with. If you're interested in learning more and developing your skills in hand therapy, especially with wound care, the mentorship program is one of the best places for you to get started, just because we have a whole module all on wound care, what to do, different types of wounds. And if you're in an work environment where you get different cases and you're just not really sure, or you just want to learn more about wound care so you can get into those jobs, check the links below. It's the mentorship program to help you develop your clinical skills. I hope to see you on the inside.